Isabel, the president's age does put him in a group that is considered vulnerable to the coronavirus, according to health officials.
Jameson, so Mary O'Connell, she spent the day digging into these risk factors and talking to doctors about why they say the president's case should serve as a good reminder to all of us to take this seriously.
The most powerful person in the world has the virus, so now we know this virus can definitively affect anyone.
A warning after the president's COVID-19 revelation. At 74 years old, doctors note his age and weight put him at a higher risk of severe illness.
If we look at patients who get hospitalized, patients who go to the ICU, patients who get intubated, and then patients who even have really bad outcomes like death, we know that those patients are 90% explained by having other risk factors.
The CDC laid out your risk of hospitalization if you have certain conditions and get COVID-19 compared to those without. Asthma, 1.5 times greater. Diabetes and obesity tripled the risk. A combination of two conditions, more than 4 times greater. Another factor, your age. The CDC explains 8 out of 10 COVID-19 related deaths reported in the U.S. have been among adults 65 and up.
The good news is we can prevent transmission by some really simple things.
Dr. Marissa Levine says think physical distancing, wearing masks, and washing your hands, which Levine says could even help during flu season. All ways to protect yourself and the most vulnerable.
We all have a responsibility as members of a society to do what we know works to protect ourselves, our loved ones, and then other people we come into contact to.
In Tampa, Mary O'Connell, ABC Action News.